You're listening to Boomers Today with your host, Frank Sampson.
Well, welcome to Boomers Today. I'm your host, Frank Sampson. Of course, each week we bring you important and useful information on issues facing baby boomers, their parents, and other loved ones. And as I do every single week, because you deserve the thanks. Thank you all for all your support. Our listeners are growing each and every day. And it's because of you. You share with friends and family the information on our podcast and radio show, which I'll share with you. You can certainly listen to our podcast on our free app, Boomers Today. Just have to download it if you have an Android or iPhone. Of course, on Google Podcasts, Apple Podcasts, iHeartRadio, Spreaker, Stitcher, pretty much all the podcast radio stations. And of course, you could go to our website at boomerstodayradio.com. And so many of you are listening to the show now because we have wonderful guests. And we, as I say, every time, because it's true, we're not going to disappoint you today. We have with us Sarah Nord. Sarah is an occupational therapist, certified dementia practitioner, and founder of Sensory for Dementia. She is passionate about supporting the sensory, cognitive, and emotional regulation needs of people across the lifespan. Sarah has over 7 years of clinical experience with specialty training in sensory processing through the STAR Institute. She recognizes how sensory health impacts function, behavior, and relationships. She raises awareness about all 8 sensory systems and equips you with a sensory lens so you can get curious about behavioral expressions from a different perspective. Sarah, thank you so much for joining us on Boomers Today.
Thanks so much for having me, Frank. I'm really happy to be here.
Yeah, this is always subject matter near and dear to my heart. As you know, being in the industry, we both deal with dementia and families on a daily basis. So we can never talk about it too much. So thank you so much. I'm always curious how and why did you get into the field of dementia?
Yeah, that's a good question. Yeah. So as an occupational therapist, throughout my whole career, I've worked with people of all ages. And I was pretty intentional about doing that rather than just specializing in one area from the beginning, because I wanted to keep my skills sharp in different practice settings and with different populations. And that also helped keep a lot of doors open. So when I was working in pediatrics with kids, that's where a huge piece of my sensory training has come from. And then in addition to working with kids, I've also been able to work with adults and older adults and have been able to kind of adapt some of the knowledge that I've learned in the sensory world and apply a lot of that information to working with adults who also have sensory processing differences and older adults as well. And so when I moved to Cincinnati a few years ago and had the opportunity to work at a skilled nursing facility that had a sensory room on their memory care unit, and they wanted to see sensory-based strategies utilized more to support the residents living there who had dementia. And so that is kind of what really jump-started my passion of combining the use of sensory-based tools as one way to help support a person with dementia's ability to regulate and engage with other people and to do the things that they need to do and want to do every day.
That's fantastic. That's wonderful. We're going to talk more about what you refer to as sensory processing and give people better understanding. But a subject matter I'd love you to address, just because I'm sure we have listeners on the phone that on the podcast that understand this, but still many people don't.
Mm-hmm.
When they hear the term dementia, they hear the term Alzheimer's, they think of the two synonymously, but it's really not exactly correct. Maybe,
Right.
maybe you could help clear that up.
Yeah, definitely. So the difference between dementia and Alzheimer's disease is that dementia is more so a category of symptoms. And if we think about it in terms of this like umbrella category, dementia is like the overarching umbrella. And then underneath that umbrella, there are multiple different types of dementia. So Alzheimer's disease is one type, for example, and it's the most common. And there are other types of dementia like Lewy body dementia and frontotemporal dementia. And so that's one way to think about it, is that dementia is always Alzheimer's disease. I'm sorry, dementia is sometimes Alzheimer's disease, but Alzheimer's disease is always dementia.
Right.
So another like an analogy that I like to use is thinking about a bowl of fruit. And thinking about, when you have a bowl of fruit sitting on your dining room table, in that bowl of fruit, you could have bananas, for example, or you could have apples, or you could have berries, but you don't have to have those things inside that bowl. So if we think about the bowl as being dementia, you might have apples, or you might have Alzheimer's disease, or you might have other types of fruit in there, but you don't have to have all of them for it to be considered dementia.
So when a doctor diagnoses somebody with dementia,
Mm-hmm.
would you say that it's possible that somebody certainly does have some form of dementia, but maybe the specific type can't be diagnosed? So it's kind of given a general, you have dementia. Would you say that, or what are your thoughts there when people say, well, my mother's been diagnosed with dementia?
Yeah, I see that a lot, often, more often than not, actually, where just a general diagnosis of dementia is given, or Alzheimer's disease is given without a really thorough assessment. So I think that it is important to try and dig a little bit deeper when possible, and when the resources are available to people to do so. And really the gold standard evaluation that's out there is a neuropsychology assessment with a trained professional who really understands how to differentiate the different types of dementia that a person can have. So if there is somebody out there that just has a general diagnosis of dementia, I always encourage try to get more information, because there are certain things that are, contraindicated in terms of whether it be medications or different approaches. And so you really want to know what it is that's going on inside the brain and the nervous system, so that you know how to really address it in the most appropriate way, and how to support that person in a way that's helpful versus harmful.
Got it. Very good. Thank you for that. So you've you referred to it before, sensory sensory for dementia, or sensory processing.
Mm-hmm.
Help us understand that. What do you mean exactly by sensory processing?
Yeah, so sensory processing is, again, it's like a large umbrella term that helps us understand how we feel, and helps us understand our bodies, the world around us. And it's really foundational also to how we understand the perspective of other people and how we relate with other people as well. So there's all these different sensory messages that we receive from the world inside our body and the world outside the body as well. So like the physical environment, the social environment, and we take in those different messages, we process them and try to understand them, and then we respond to them in different ways. And some people respond in ways that are just right. This is kind of like the Goldilocks analogy now. So some people respond, just right, and it doesn't impact their function day to day. Rather, it supports their function. Some people respond too much or too fast, and we call that over-responsive sensory processing. And then other people might respond too little or not enough or too slow, which we would consider that being more of like an under-responsive sensory system. So in addition to the way we respond, it also influences how we move and how we plan our movements and how we execute those movements. And, when we make a mistake with a movement, how we adjust and adapt to then do it differently next time. And it also helps us really understand the fine and intricate details of the information in our world. So, for example, what does a scratchy versus soft sweater feel like on our skin? How about hot versus cold water, or the feeling of being nervous versus excited? All those different things kind of fall under this concept of sensory processing. And I like to point out that everybody's experience with sensory processing is unique. And so it's really hard to say there's this one blanket strategy that is like a one size fits all thing for everybody. We all process sensory information differently and uniquely, so we have to approach it in that way.
You started to give some examples, which was great. Maybe you could give some more. I know there's different sensory systems out there, so maybe you could give some examples. Yeah,
totally. So we're all pretty familiar with the 5 sensory systems that are taught. I don't know if it's in elementary school or so, but we know about vision, our visual system, our auditory system, which is more related to hearing and hearing processing, the olfactory system, like our sense of smell, gustatory is taste, and then tactile is touch. So when talking about those 5 main senses, vision, hearing, smell, taste, and touch, we're not just talking about seeing, for example, or hearing, for example, but we're talking about all the information that gets processed and filtered out and responded to. So if you think about hearing, you hear a sound in the environment. Maybe it's a bird chirping outside, and you might turn to listen to that sound and try and identify where did that sound come from. And then you use the processing that occurs in the brain to determine, okay, is that a sound of like a woodpecker or a robin, for example? And then additionally, we have 3 other sensory systems that are really foundational to the way that we do everything in our day-to-day life. The first one is the vestibular system, which deals with our head position in space and our sense of balance and really our overall sense of safety. So this system is really activated during activities like yoga, when you're moving your head in all different positions, driving in a car, bending down to pick up a pencil you might have dropped on the floor, being pushed in a wheelchair down the hallway. That's when that system gets activated, for example.
Mm-hmm. So, and then, go ahead. Finish. Yeah, go ahead.
Yeah, and another one is called our proprioceptive system, which is a really fancy word for body awareness. So this is looking more so at like the position of your whole body in space. And when people have trouble processing this system, it might look like bumping into things or increased clumsiness or using way too much pressure to do an activity that maybe just requires a little bit of pressure or force, such as like holding a paper cup and squeezing the cup to the point where like water comes out of the cup because too much pressure is being used in the hand. And then the final one, the 8th sensory system, is called the interoceptive system. And this one helps us understand our internal body state. So, for example, around right before lunchtime, you might notice that your stomach starts to growl. And that's our body's way of saying, okay, these are the internal cues telling me that I'm hungry. Or like a lump in your throat tells you might be nervous. Or when your muscles are really tense, maybe you're feeling stressed, versus when your muscles are loose, you're feeling more relaxed. So all those different systems are key. And oftentimes we only talk about the 5. And so I'm trying to raise more awareness about the other 3 foundational systems that are so key to everything that we do.
Great. So we're going to take a real short break, I promise, just to recognize our sponsor. When we come back, I'd love you to talk about, the sensory system that you were speaking of and how it relates to people with dementia. And,
Mm-hmm.
We have, I'm sure, several adult children and people in the industry that listen to the show. And so that I think that would be quite helpful. How about we
Sure.
do that? All right. All right.
Sounds
So
great.
I want to remind everybody that today's show is sponsored by Senior Care Authority, an elder care consulting organization that has a national network of professionally trained and experienced local advisors to assist families in determining the right path for your loved ones. And they'll discuss various long-term care options, whether it's in-home care, assisted living, memory care, nursing, or if you just need an advocate to get advice from. A local senior care authority advisor can help you now. So for a free 30-minute consultation with an advisor in your area, contact Senior Care Authority at 888-809-1231, or you could go directly to the website at seniorcareauthority.com. And recently, Senior Care Authority has also added an additional service of a driving assessments for elderly, and so feel free to contact an advisor for information on that as well. We're back with Sarah Nord, who's an occupational therapist, certified dementia practitioner, and founder of Sensory for Dementia. So maybe before we get into the Sensory for Dementia part of it, Sarah, why don't you share with our listeners how they could get a hold of you and any information that you'd like to share.
Sure. Yeah, so I have a website that's probably the best place to start. That website is www.sensoryfordementia.com. And you can also email me at sarah@sensoryfordementia.com if you have specific questions or want to learn more. And I'm also active on social media, on Instagram and Facebook. The link to find me there is just at Sensory for Dementia. You could also type in my name, Sarah Nord, and find me that way.
Great.
So yeah, that's probably a good place to start.
Perfect. So we were discussing the various sensory systems, and you talked about that. So somebody said, all right, how does that all apply to my mom or my dad or my grandmother? I mean, how does that all fit in with people with dementia?
Yeah, that's the best question.
Okay.
So with dementia and with sensory processing and aging in general, these sensory systems over time do start to fail a little bit. And we notice that when older adults might become hard of hearing, or their eyesight might start to fail a little bit. And so that part of that is normal, not all of it. And so we know naturally that there are going to be some sensory changes as people get older. And also people are living longer now too. So those changes that we're seeing over time might be even more pronounced. And when we're talking about sensory processing, we also think about the interconnection that it has with motor processing and cognition and all those other skills that impact our function. And so we need to start, trying to think about, okay, as we age, what are some of the changes that occur naturally? And are there things that we can adjust or prevent so that we can really optimize the way that we're functioning in the world? So, for example, I try to think about, which one came first? Is it that people are getting older and they're not moving as much or not as physically active? And that's what's causing increased sensory sensitivities or difficulties over time? Or is it vice versa? Did somebody have a history of sensory processing difficulties that was either diagnosed or not? And is that causing a lack of engagement because of all the other moving parts and pieces that come with a dementia diagnosis? So it's one of those things where so often when we're looking at some of the different behaviors that we might see, or some of the functional challenges that we see, we look at almost like this top-down approach where we're trying to figure out, okay, what is it about the brain and the body that is impacting this person's ability to function, or why is this behavior occurring? And one of the things that that I understand is that sensory processing is so foundational as one of the very most baseline things that we can consider as it impacts function. So we're trying to look at, okay, is there something in the environment that is impacting this person? Is there something socially that's impacting this person? Is there a sound? Is there a bright light? Is there a movement that is really stressful to their system? And is it something that they can communicate to us, or is it something that we have to try and get really curious and really creative about to pinpoint what it is that we're seeing? So it kind of gives people another opportunity to look at a behavior or a functional challenge in a different way, and not always just jumping to giving a person medicine or some other strategy that doesn't necessarily get to the root cause. And when I say that, I definitely know that medicine is a very helpful tool and important in different ways. It's just not something that I'm trained to provide. So it's not my area of expertise, but I know that it is helpful in various scenarios. Right. But what we can offer here is another more like non-pharmaceutical approach to trying to understand behaviors and then respond in a way that is fairly accessible.
So can I throw one at you that I'd love to get your comments on? I'm sure you've dealt with it. I know we deal with it as an organization all the time with families, but we hear, mom or dad, they just don't want to take a shower anymore.
Yeah.
They don't want to bathe. They get bothered by a shower or something. And what advice would you give to somebody who is dealing with that, which is unfortunately pretty common?
It's very common. You're right. Yeah. So with showering, there are so many different parts and pieces to consider here. And I'll just start with like the feeling of the water, for example. When looking at the way shower heads are designed, they have all these little holes that the water comes out individually from. So it's almost like this light touch sensation on the skin. And when we talk about our sense of touch, there is light touch sensation, which can be very aggravating to the system and very stressful. And then there's this deep touch pressure that we get from like a massage or a hug. And so the water that's coming out of the shower head is causing this like light touch sensation on the body. And sometimes when there's a sensory processing difference, that sensation can actually be misinterpreted as pain. And so people will actually call out as if they're in pain. And, when we knowing what goes on with the different sensory systems and sometimes how those messages can get mixed up in the brain, that person is actually feeling pain. So there are different things that we can do to help support that one specific area. First of all, looking at the equipment that we're using and what kind of shower heads are we using, how much pressure is coming out of the shower head. And then also using a shower head that is removable and handheld, so that the person that is showering has as much control as possible over that water stream. So they know exactly where it's going and when it's going. And if they don't have the motor control to use the shower head themselves, then it's really important that the caregiver or the care partner that's working with them helps to make that experience as predictable as possible. So, okay, mom, I'm going to put the water, you're going to feel water on your back. Or mom, you're going to feel water on your leg. Mom, you're going to feel some water on your arm. Those kind of things help the person's nervous system prepare for an experience rather than being startled by it. And that can really help regulate a person's sensory system when it kind of knows what to expect rather than being surprised.
That's a great
piece.
Yeah, that's a great explanation. So, boy, I could talk to you all day. We have a couple minutes left. Maybe you could just give an overview. I know that your organization has training and educational programs available. Maybe you could share some information on that.
Yeah, so I do provide educational consultation for care facilities, healthcare professionals, groups of caregivers, and then also the general public too. And those can be done virtually by phone or video conference, and then also in person as well, as people feel comfortable with that. And then I also provide courses, and I have a list of various course topics on my website. But if you're looking for something customized, then there are customizable options as well. And the best way to approach that is to just reach out to me by email or using the little contact form on my website to share with me what your specific needs are and what questions you may have. And then, we can design something from there.
Perfect. So with just about a minute left now, maybe any words of wisdom for those out there that are dealing with somebody now that maybe they've been recently diagnosed with some form of dementia. Any words of wisdom that you can give to family members?
Yeah, so I would say to just get curious. And sometimes what you see and what you think is happening isn't always what is happening. So try to get curious and not make assumptions, and realize that there are so many different reasons for why we're seeing what we're seeing. And when we really try and get to the root of that, to the root of what we're seeing, we can really make a positive impact, not only for our loved ones, but also for ourselves as well. So that's my big piece of advice, is really get curious and don't limit yourself to just what it is that, your eyes are seeing in the moment.
Great. Sarah Nord, thank you so much for joining us on Boomers Today. Check it out, sensoryfordementia.com. Thank you so much, Sarah.
Thanks, Frank.
Yeah, thank you. And I want to thank everybody for joining us on Boomers Today. Please be safe, and we'll talk to everybody real soon.
You've been listening to Boomers Today with Frank Sampson. To learn more about today's show, visit boomerstodayradio.com and join us next time for another edition of Boomers Today.